Cortisol, also known as hydrocortisone or stress hormone, is a glucocorticoid hormone. Glucocorticoids are steroid hormones secreted by the zona fasciculata of the adrenal cortex. The most important glucocorticoid in humans is cortisol. Cortisol secretion is regulated by the hypothalamo-pituitary-adrenal HPA axis. Hypothalamus secretes corticotropin-releasing hormone CRH. It stimulates corticotroph cells of the anterior pituitary to release ACTH, that is adrenocorticotropic hormone. ACTH then acts on the zona fasciculata of the adrenal cortex and stimulates the synthesis and secretion of cortisol. Positive regulation of cortisol secretion is produced by factors that stimulate the HPA axis. These factors include stress, hypoglycemia, circadian rhythm, and inflammatory cytokines. Stress is the most important regulator of cortisol. It stimulates the hypothalamus to secrete CRH. Cortisol follows a natural circadian rhythm, which means its secretion is not uniform throughout the day. We can appreciate this by observing the graph. As you can see, the cortisol levels typically peak in the early morning between 6 am to 9 am and reach their lowest levels around midnight. Additional elevations at other times may occur in response to stress or other physiological stimuli. Coming to negative regulation, cortisol itself acts through a negative feedback mechanism. It inhibits secretion of CRH and ACTH. This is called long-loop negative feedback. Let us move to the functions of cortisol. We will start with effect on carbohydrate metabolism. Cortisol increases blood glucose levels by stimulating gluconeogenesis, which is the formation of glucose from non-carbohydrate sources like amino acids. Thus, it has hyperglycemic action. Then effect on protein metabolism. Cortisol promotes proteolysis, that is breakdown of proteins, particularly in the skeletal muscles and other extrahepatic tissues. The amino acids that are released due to protein breakdown are transported to the liver, where they are utilized for gluconeogenesis. It also decreases protein synthesis. Effect on fat metabolism. Cortisol stimulates lipolysis. This breakdown of stored fat releases fatty acids and glycerol. The fatty acids can be used directly as an energy source, while glycerol serves as a substrate for gluconeogenesis in the liver. An important function of cortisol is its permissive action. Cortisol is essential for other hormones and metabolic reactions to exert their full physiological effect. For example, glucagon becomes more effective in the presence of cortisol. In the fetal lungs, cortisol stimulates surfactant production by type 2 pneumocytes. This promotes lung maturation. Cortisol is a powerful anti-inflammatory hormone. It suppresses various stages of inflammatory response by stabilizing lysosomal membrane, reducing capillary permeability, decreasing migration of white blood cells to the site of injury, and inhibiting the synthesis of inflammatory mediators such as prostaglandins and leukotrienes. As a result, redness, swelling, pain, and tissue damage are reduced. This property forms the basis for the clinical use of corticosteroid drugs. It also has anti-allergic action. Cortisol reduces allergic reactions by inhibiting the release of histamine and other mediators from the mast cells and basophils. So, Glucocorticoids are commonly used in conditions such as bronchial asthma, allergic dermatitis, and severe allergic reactions. Effect on cardiovascular system. Cortisol increases the responsiveness of blood vessels to catecholamines such as adrenaline and noradrenaline. Thus, it plays a role in maintaining cardiovascular stability during stress. Cortisol increases red blood cells, platelets, and neutrophils. It increases RBC count by stimulating erythropoietin. Cortisol decreases lymphocytes, eosinophils, and basophils. It shows the following effect on bone and connective tissue. Cortisol inhibits collagen synthesis and decreases osteoblastic activity. It also reduces absorption of calcium from the intestine. As a result, prolonged exposure to high cortisol levels can cause osteoporosis, easy bruising, and poor wound healing. Effect on central nervous system. Cortisol influences mood, behavior, and cognitive functions. High cortisol levels decreases REM, that is rapid eye movement sleep, and increases non-REM sleep, resulting in poor sleep quality. Cortisol effect on gastrointestinal system includes stimulating HCl secretion and decreasing calcium absorption from the intestine. So it can lead to increased gastric acidity and peptic ulcer. Its effect on muscle is decreased muscle mass and strength. Cortisol also shows effect on water and electrolyte balance. It helps maintain normal water balance by increasing glomerular filtration rate GFR and reducing the action of antidiuretic hormone ADH. Before moving to clinical correlation, let us understand why cortisol is called stress hormone. Any physical, physiological, or emotional factor that disturbs body's normal balance is called stress. Examples include trauma, surgery, infection, fever, burns, anxiety, fever, or even intense exercise. So, as already discussed, stress stimulates the hypothalamus to release cortisol. Cortisol then helps the body to cope with stressful situation by increasing blood glucose levels, maintaining blood pressure, preventing excessive inflammation, etc. Thus, cortisol acts as the body's survival hormone, preparing the body to adapt and overcome stressful situation. For this reason, cortisol is regarded as the stress hormone. But what happens if cortisol becomes excessive? Well, this results in a condition called Cushing syndrome. The clinical features seen in Cushing syndrome are hyperglycemia, central obesity, moon face, buffalo hump, thin limbs, muscle weakness, purple striae, easy bruising, osteoporosis, increased infections, and mood changes. We will discuss Cushing syndrome in detail in another video. And that wraps up a high yield overview of cortisol.